very hard. It's a tough situation for him and every mayor because nobody's ever seen the scale. You know, when you hear you've given millions of masks and you've given hundreds of thousands of masks in a certain short period of time, and then you hear they need many, many more. You know, one of the things they have started with respect to masks is the sterilization process. Some are really, it works very well. Others aren't really set up that way. You throw them out. But we have a sterilization process that's working very hard. Speaking of that, hand sanitizers, you know, when you asked the question on the companies and what's going on, we have many companies now. Companies that made whiskey, that made alcohol. They've now gone very quickly into the hand sanitizers and all of, you know, you've been reading about 3 or 4 big companies. We're doing incredibly well on that. There was no way if you took the existing companies that something like that could happen. But it happens almost, they'll call Peter Navarro or they'll call somebody. In one case, they called me. They said, we can do this, we can do that. We've had a lot of those calls where companies want to, there's a company in New Hampshire, a great company, they want to make ventilators. I'd never thought of them for ventilators, but they do make metal equipment and things out of metal. They'll be great. They'll make a great product. So, Peter, I think you're seeing a lot of that, right?
Yes, sir.
Yes, please.
Mr. President.
The bill that is being contemplated by the Senate right now has a fund that has hundreds of billions of dollars for the Treasury Department to use to bail out states and localities as well as specific industries such as cruises and hotels. Will you commit publicly that none of that taxpayer money will go towards your own personal
Well, you know, every
properties?
time I do it, like for instance, I committed publicly that I wouldn't take the $450,000 salary. It's a lot of money, whether you're rich or not, it's a lot of money. And I did it, nobody cared. Nobody said thank you. Nobody said thank you very much. Now, I didn't commit legally. I just said, I don't want it. I don't want my salary. I work for zero. I don't want my salary. Nobody said, oh, thank you very much. But I guarantee you, if I ever took it, you would go out after me, you in particular, would go out after me like crazy. So I have no idea what they're talking about with regard to the one element. Everything's changing, just so you understand. It's all changing. But I have no idea. But every time I commit to do something, I committed to do many. Look, I ran, and everybody knew I was a rich person. I built a great company, and people knew that. But I agreed to do things. I didn't have to. I still don't have to. But my company, I told the kids who are running it, I'm not running it, but I told them, don't deal with foreign companies. Don't deal. I didn't have to do that. I could have just ran, and I didn't have to do that at all. And instead of being thanked for, again, not agreeing to do it, but just for not doing it, I get excoriated all the time. So I've learned, let's just see what happens, because we have to save some of these great companies. They can be great companies literally in a matter of weeks. We have to save them. Yeah, please.
Thank you, Mr. President. Can I go back to your announcement at the top about the National Guard and then also the medical structures that are going to be built? Okay, so you had said that there would be 8 large medical structures that will be built in California with more than 2,000 beds. And then I think I heard you say there would be 4 small medical structures in the state of Washington with 250 beds. And could you say what cities and areas those are going to be in specifically?
So we are filling the governor's request, and so we send that resource to them. They'll put it to best use. They'll put it to where they will have the most effect. So we don't dictate exactly where it goes. Again, it's a request from the state to the federal government for a certain asset, and those assets are sent to the governor can use it as he or she sees fit.
And you're still considering, you just said that using the cruise ships as well. So
If we need them. I hope we don't need them. I hope you're going to have great luck on Tuesday morning. We sent a lot of the medicine. We don't have to go into it again, but we sent a lot of the medicine to Governor Cuomo. I believe they already have it. And they have some very capable people. We spoke to Dr. Zucker, who is his primary representative on this. And we spoke to the governor himself. And I think he's excited about it like I'm excited about it. Now, will it work? I think it has a really good chance. I think it's worthwhile. Why should we be testing it in a test tube for a year and a half when we have thousands of people that are very sick? They're very, very sick. And we can use it on those people and maybe make them better. And in some cases, maybe save their lives. So, Governor Cuomo told me they'll be using their supply, starting their supply on Tuesday morning. I think it's very exciting. I think because if that happens, much of what we're talking about with ships and hospitals and all of the things that we're doing and all of these masks and everything that we're ordering, ventilators, it's a whole different game if that happens. And we'll see. There's been some tremendous signs that this could work. Now, again, some doctors think it should go for years and testing, but, this has been something that's been around for many years. It's been phenomenal, strong, powerful drug for malaria. But we think it might work on this, based on evidence, based on very strong evidence. We're going to see. We're going to know on, sometime after Tuesday. But you'll have to ask Governor Cuomo. I think they're going to start the process. We've gotten them the drug. I think they're going to start the process of giving the drug mouth, through mouth. And I think that starts on Tuesday morning, he said. And that'll be, I tell you what, I don't want to get anybody overly excited, but I'm very excited by that, by the prospect of it. Then in addition to that, they're working, NIH is working on vaccines and all, and they're making great progress. But the vaccine does have to be tested for a long period of time because you can't give, thousands, millions of people a vaccine and it turns out to be dangerous. So that does have to be tested. But this one's been taken for a long time, so we know pretty much one result. Yeah, please.
Yes, thank you, Mr. President. I wanted to ask about China and President Xi. When was the last time you had a conversation with
Well, I don't want
him?
to exactly say that, but I have spoken to President Xi about this, specifically about this. And look, he doesn't want this. This is not something that he wants. And it happened. It happened to China. And one thing they told me, I was told by our great Secretary of Agriculture, Sonny Perdue, that China's been buying a lot of our farm product. And I'm looking at different pricing. But China has, despite all of this, and it started, this delayed it a little bit, obviously, but it started fairly recently. But China's buying, we made a new deal, as you know, with China, a very big trade deal. And China has been buying our agricultural product.
Have you talked to China about masks? They've been a supplier of the United States of masks, of a lot of this
Yes,
equipment.
in fact, they're
Have you
sending
tried to
some
open those
masks.
back up?
They're sending masks to Italy. They are sending masks to Italy. We're in a very good process with masks. But I'm a little upset with China, I'll be honest with you, because as much as I like President Xi and as much as I respect the country and admire the country, I have great admiration for the country, what they've done in a short period of time. Of course, our previous presidents allowed that to happen. You should say thank you very much to all of them. But they should have told us about this. And I did ask him whether or not we could send some people in. They didn't want that. Out of pride, I think really out of pride. They don't want us sending people into China to help them. China's a strong country. They have their scientists and they have their doctors, very smart, a lot of people. But I did discuss that about sending our people in, and they didn't really respond. We went again, they didn't respond. If they went in, they would have been able to give us a much earlier indication. But we had an early indication. That's why I closed out China. I felt it was my instinct, but that's why I closed out China at a very early time. Please.
Mr. President, are undocumented persons welcome at testing sites, and can they show up and be tested without fear of being reported to immigration officials for possible deportation?
It's really a fair question. I think I'll let. Would you like to answer that question? Please,
Absolutely.
please. Surgeon General.
We know from a public health perspective that it is important that people who have symptoms can get tested. But as you heard earlier, we are
Regardless of citizenship.
well. We know that the virus doesn't judge based on where you're from, and so it's important that we try to get people tested who have symptoms. But the important thing that we really want people to hear is that inpatients need to be tested. We need to prioritize our healthcare workers. And one thing I would like to say to you all very quickly, on behalf of the doctors on the task force, healthcare workers, we hear you. We hear you, and we absolutely are prioritizing your health and safety, making sure healthcare workers can get tested, inpatients can get tested, people at highest risk. But to answer your question, yes, we absolutely want to make sure people who have symptoms, who could be spreading it, can get tested.
Without
Surgeon
fear.
General, I have a question, sir. Sorry, question.
Okay,
Surgeon General, Department of Homeland Security addressed that issue a few days ago. Customs and Border Protection actually issued guidance that absent certain circumstances, Customs and Border Protection does not target emergency rooms or health clinics. And I would refer you to the website. They issued a very clear statement making it clear to any person that is in need of a test or medical care that Customs and Border Protection is not focusing on emergency rooms or health clinics or the drive-through clinics.
So that they could come in without fear of...
Yes, I'll answer that, and if that's not the policy, I'll make it the policy. And I was just saying, as Mike was saying that, the answer is yes, we will do those tests, because I think in that case it's important. I think that if you could say illegal alien, you could say illegal immigrant, you could say whatever you want to use your definition of what you're talking about. We're all talking about the same thing. Yes, we will test that person, because I think it's important that we test that person, and we don't want to send that person back into wherever we're going to be sending the person, whether it's another country or someplace else, because, we're now bringing them right out of our country. But yeah, we will test those people. Okay?
Question for the Surgeon General.
Yeah, please.
Sorry, Mr. Surgeon General, a question for, we were talking about this before the briefing. A lot of folks, they're watching TV, they're reading up on this constantly. If you are not, somebody who's got a pre-existing health condition, but you all of a sudden you go, all of a sudden I just don't feel 100%. And then your mind just starts playing with you, right? You think, oh my God, I coughed 3 hours ago. Was that a first sign? When should those people really start to say, okay, maybe I need to call the doctor? Because you don't want to flood them. But a lot of people that are probably healthy right now are thinking, whoa, wait, that's all I'm hearing about. That's all I can think about. When should I either call a doctor or get tested?
You need a test?
Well, I hope not.
I asked him before you came in if they'd been temperature checked.
Right? You better not.
The Vice President gave an important statistic this morning. Only 10% of the people who have symptoms who've been tested actually tested positive for coronavirus, meaning 9 out of 10 people who actually likely had symptoms do not have the coronavirus. So I want people to understand that so that they are reassured. I also want to direct people to a website we've been telling them about all the time, coronavirus.gov. Coronavirus.gov has information to walk you through the symptoms, fever, cough, shortness of breath, body aches, and what to do if you have symptoms or you're worried. The most important thing we can tell people is call your healthcare provider, talk to your healthcare provider. Information is at coronavirus.gov to walk you through when to come in and when and what to do.
And Mr. Vice President, you got tested yesterday. I'm just curious, sir. Can you tell us what that was like for you? A lot of people are going to be going through this. What were you standing by the phone? Were you just having an iced tea? I mean, what did you? Yeah, what was that like? And what did you do to kind of kill that time to keep your mind at ease?
He wasn't.
The test was very quick, but it goes a fair amount up into your sinuses, and it's not comfortable. And that's the reason it probably is a good opportunity to say again to any American looking on. If you don't have symptoms, you don't need a test. The current testing format, although they're evolving regularly now, we just mentioned that we think at the end of this week there'll be a new test, and there's all new technologies. I would say again to all the governors that are looking on and their state health officials, contact FEMA. We'll give you all the latest information on new testing that is available, including steps we're making where Americans would be able to test themselves and send it in.
For you, what was that like for you, sir?
Well, for me and Mrs. Pence, it was kind of a pinch. It was kind of invasive, but we were grateful for the support. Walter Reed Hospital processed the test very quickly. They had a lab at the hospital to be able to do that. And gave us the results quickly. But it also informed me. We were wondering during that time as a family. And it's one of the reasons the President's made it such a priority that we brought all these commercial labs together. And now more than 250,000 tests have been done. We believe we'll be caught up, if you will, by the middle of this week on a backlog of tests. But we announced today that we are directing commercial labs to prioritize people who are in the hospital for tests, is we want to continue to work with new technology and with the new focus and guidance from HHS to get the results of that as quickly as possible for every American. So if they have coronavirus they can be properly treated, or they can have the peace of mind that they may have some other respiratory ailment, but not that.
Mr. President.
And you know, anybody that knows Karen Pence knows this, because the vice president told me. He said she actually handled it better than him. Right? That's true, right? I didn't handle it so well either. Don't worry about it.
President, Speaker
Yes,
Pelosi earlier today said that the House may introduce its own bill. A, are you willing to work with the Speaker on a House bill? And given what happened in the Senate just a short time ago, what are you willing to do to get this bill over the finish line, given the urgency? Secondly, did you send a letter to North Korea's Kim Jong-un seeking cooperation
Yeah,
with the
numerous countries,
coronavirus?
yeah.
And if so, what
Sure,
type of...
with numerous countries. If they need help, we'll give them help. There's nobody has what we have, especially with the new tests that are coming out. North Korea, Iran, by the way, and others. We are open for helping other countries. And there's a very serious time, and North Korea is going through something. Iran is going through something very, very strong. Iran is really going through a very difficult period with respect to this, as you know. So I've put it's really a glad hand, it's all it is, to North Korea, to Iran, and to many other countries. And we're working with, as the doctor can say, we're working with many countries with respect to the problems that they have. Again, it's over 140 countries right now. But North Korea, Iran, and many other countries, we will help, and we're willing to. As an example, this new test. If this new test works out, where instead of going through what we all went through with this rather difficult test, to put it nicely, we would have, is that just a swab on the tongue, doctor? Or how does that work?
It's a similar swab, but they can work in and do it in the nose.
Not to the same all the way
It
doesn't go all the way up and hangs right under your eye, right? So that's a tough test. So if we do that, the procedure, the test, and nobody has this in the world. Nobody has this. This is developed by us. We think it's going to be certified soon. We think it's going to be very good. But if we have that, we'll be able to help a lot of countries. Please.
What about Speaker Pelosi, sir? What about Speaker Pelosi?
We're going to work with everybody to see if we can get something done. Please.
I mean, just to follow up on that, are you willing to work directly with Speaker Pelosi?
Yeah, we'll
as
work
you
with
write the House bill?
whoever we have to. We have to help the American worker. We have to help the countries from which the American workers, I mean, they came out of these companies, they were doing phenomenally well. You saw where payroll was going way up, where wages were going way, way up. There's never been a time like this. We can't lose those companies, and we want the worker to be happy. And we're being, I think, more generous than anybody's ever been. We want to take care of the worker, but we want to make sure that when we win the war, it's only a question of, it's when, not if. When we win the war against the virus, we want to make sure those companies are ready to charge forward, not that they've been disbanded because we were penny wise and dollar foolish.
There are factories around the world that produce medical protective equipment that are used in European hospitals. They've been certified for use at the highest level in European hospitals. Yeah. Is the FDA and your administration willing to look at a waiver for that equipment to be sold from those factories?
Well, we were asked that question a little while ago, and the answer is we may, but we may not need it. We do a very high standard. Our standard is higher. Please.
Thank you, Mr. President. I was hoping you could give some guidance to American families who are anxious about their financial futures. Earlier today, on one of the Sunday morning shows, the Secretary of the Treasury, Steve Mnuchin, was talking about the millions of Americans who are impacted by these shutdowns that are happening in cities and sometimes full states.
Yeah.
And Secretary Mnuchin said that this shutdown, this lockdown, could last 10 to 12 weeks, perhaps early into June. Given that, would you consider another fiscal stimulus, another check to these families?
We're going to see what happens. Hopefully we won't need it, but we might. But we're going to see what happens. Look, the greatest thing we can do is win the war. The war is against the virus. That's the war. We do that, I really believe everything's going to fall into place. It's going to be beautiful. I call it a pent-up demand. People are dying to go out to a restaurant. People are dying to go onto airplanes. I think there's a tremendous pent-up demand. You may be surprised to the degree. I think it's going to go very rapidly because this wasn't a financial crisis, just the opposite. This was a medical crisis.
Did you sell stocks, Mr. President? Did you or your family sell stocks?
No, I don't have stock. I own things that.
Make any alternates to investments in advance of this?
No, I don't even think about it. You know, it's very interesting that you ask a question like that. You know, nasty question, and yet it deserves to be asked, I guess. What I've done by deciding to run, I knew this the first day. I said, if I win, it's going to cost a lot of money. It cost me billions of dollars to become president, to be president of the United States. In things that would normally be run at a certain thing, even people that don't like me because they think I'm too tough on the border. Now, some people love me for it. Other people don't like me at all. You know, it's very funny. My wife, we were at a charity event in New York City. I had just announced that I was running, and we were at the Robin Hood Foundation at the convention center, which now we're going to be converting to hospitals for Governor Cuomo, right? And I was walking in, and there was a smattering of boos and a smattering of cheers. I was getting both. And our very popular First Lady, she's turned out to be a very popular, people have great respect for her, but a very popular First Lady said to me, that's strange. I've never heard anybody booing you. That was very early on, because I think I called for strong borders, or I called for something that other people don't like, you know. And I knew this would happen. I knew it was going to happen. But the fact that I ran, and I knew as soon as I announced, when I ran, I said, it's going to cost me a fortune, not only in terms of actual costs. Look at my legal costs. You people, everybody is suing me. I'm being sued by people that I never even heard of. I'm being sued all over the place. And doing very well, but it's unfair. But I'll say this, in terms of running for president, and I don't think rich people, Michael Bloomberg spent now as determined almost $1 billion, and look what happened. I think it's very hard for rich people to run for office. It's far more costly. It's just it's a very tough thing. Now, with all of that being said, I'm so glad I've done it, because, you know, there are a lot of rich people around. Got a lot of rich friends, but they can't help, and they can't do what I've done in terms of helping this country. We are doing things. We got sidetracked by the invisible enemy, but you know when you look at what we've done, I said before, with the veterans, with all of the things we've done, especially choice, but when you look at all of accountability, when you look at all of the things that we've done, rebuilding the military. The tax cuts, which thank goodness we had the tax cuts, because we had cushion. Oh, without that, this would have been catastrophic. We had a big cushion. I mean, with all of the losses that you've seen in the stock market, we're basically back, and with this horrible thing, if this would have happened before, you would have had nothing left. This was all cushion. But I will say that it cost me billions of dollars to be president, and especially with all the money I could have made for the last 3-4 years, and I didn't because I was being president. I have no interest in it. I'm allowed to. You know, I don't know if you know, George Washington, they say, he was a rich man, supposedly, relatively rich. And he ran the presidency, and he also ran his business. They say he had 2 desks. Nobody complained until I came along. I got elected as a rich person, but nobody complained until I came along. So it cost me billions of dollars to be president, and I am so happy I did it, because who cares? Who cares? I'm really happy with the job we're doing, and I'm glad that this team and me are here for this horrible thing. I mean, it's a number of people have said it, and I feel it, actually. I'm a wartime president. This is a war. This is a war, different kind of a war than we've ever had. And when you look at the economics of the war, in the past we used to stimulate to get people jobs. Now we're stimulating to protect people because we don't want them to work, because we want them to stay away from each other. We don't want them to gather, social gathering. So we're paying billions of dollars more than that so that they don't gather. They don't, because we have to defeat this virus, and we will. But it cost me billions and billions of dollars to be president, and I am so happy I did it.
Williams, people who got private.
Mr. President, can I
Go ahead, how about
ask
you?
about foreign countries, please? I realize that your priority is to Americans and, of course, this nation. But what about, have you ever considered supporting the foreign countries who are also fighting this global pandemic?
Well, we do help foreign countries. I mean, that was the other question.
Right.
And I'm
They're
honored to
all
help.
failing
And
out.
the
Right.
doctor has helped. The Surgeon General is speaking to other countries all the time. They're asking him questions. What do we do? Nobody's ever seen anything like this. They're calling our people all of the time. And yes, I have let it be known that we'll help people, including North Korea, including Iran, and including many other countries. It's very important to do that.
Are you considering any financial support for them? Let me quote to you two retired, a retired general and a retired admiral from the U.S. Global Coalition. No matter how successful we are in fighting the threat of COVID-19 pandemic at home, we'll never stop it unless we're also fighting it around the world. So financially, is there anything in the stimulus bill? And then are you considering any
So,
financial
no, not in the stimulus bill, but we are very much, I mean, we give away billions of dollars for, as an example, AIDS in Africa. We're still fighting that battle. It's a tremendous battle, tremendous war also. But we're fighting it here, as you know, in 10 years. Now it's 8 years because I started it. Should have been started before, long before I got here, because they had the answer even before. But we're fighting that battle. We'll be AIDS-free in approximately 8 years. It looks like that is going to happen. We're spending a lot of money, but we're spending a lot of money with other countries. If you look at the aid that we give to other countries, we give billions and billions and billions of dollars to other countries. And a lot of times I say, you know, we could save a lot of money. We shouldn't have. And then they come in. I say, what's it used for? It's used to fight malaria. It's in countries that are very poor. It's used to fight AIDS in Africa. It's used to fight many other things, many other things. And I don't think I've ever said no. I can't. It's just so terrible. Countries that we have really, we're not involved with them very much, other than there would be tremendous death. Tremendous death. I mean, you can get a list, and I could get you a list. We give away billions of dollars to other countries. And we are giving away a lot in terms of everything. And probably we'll end up economically doing something for other countries. But when I'm presented with these lists, that yes, sir, in Africa we're fighting AIDS or we're fighting something else, I tell you what, I start off by saying, you know, we could save a lot of money. And then by the time they walk those lists into my office, I say, we have to keep doing that. That's humanity you're talking. How about one more question? Yes, please.
Thank you. I wanted to ask you about the states that have not yet issued stay-at-home orders. So in Texas, for example, the hospitals have said that they expect to run out of beds by the end of April if the governor does not issue a stay-at-home order. Dallas County just announced an order. It's not
Well,
uniform.
states have to call. That's a great governor. You're talking about Greg Abbott in Texas, and he's a great governor, and he knows what he's doing. A lot of the areas that he's talking about, a lot of the counties he's talking about are not very strongly affected. You know, it's a very different kind of a place and a great place. But I have total confidence in Governor Greg Abbott.
You're okay with
I
a
do one more. Go
lack
ahead.
of uniformity between
Yeah,
states
sure, because
and
it's
within
every
the
state is
states?
different. Every state's different. I mean, Idaho, West Virginia, Iowa, Nebraska are much different than New York, than California, Los Angeles as an example, or San Francisco. They're much different. I mean, it's much different. The hot spots right now are state of Washington, and probably number one by far right now is New York. That's the hot spot like no other hot spot. And California is a hot spot, but New York right now is the leader. There's no question. All right, final question.
Thank you, sir. Your administration is backing a lawsuit to invalidate the Affordable Care Act. Given that people are losing their jobs now and need health care more than ever, would you consider rethinking your position on that?
Well, that's a lawsuit coming out of Texas again. That was headed up by Texas. And what we want to do is get rid of the bad health care and put in a great health care. And we will always, I will say this, I can make this commitment to you, the Republican Party is fully backing pre-existing conditions. Now, if we could get a great health care plan, which would need the House to do, but if we can get a great health care plan, we will only do it if we have pre-existing conditions totally back. So we're backing pre-existing, but would like to get rid of bad health care. Now, we are running the bad health care much better than it was ever run, and we're making it better. but it could be much better than it is. And so what we want to do is terminate it, have a great health care, but we will only do it with pre-existing. We will back pre-existing conditions, okay?
But what if the Supreme
Thank you all very much. Thank you. We'll be back. We'll have a meeting tomorrow.
Mario Villar, not Jose, if you wanted to clarify that, you had said Jose, works for us.
Mario.
Yes.
Oh, did it take Jose? I watched Jose on NBC.
Thank you, sir.
The other night. Okay?
Thank you, Mario.
Donate blood. Donate blood.